Good day, ladies and gentlemen. I'm Dr. Neo Chuan from Pingtung Christian Hospital, Taiwan. I would like to share with you the acupuncture role in ICS, humanitarian health service, and treatment of post-surgery pain and residual completion today. You can see that in order to achieve this, firstly we must make sure that acupuncture is helpful and effective clinically, can be used during humanitarian health service or internationally, and also to make sure that acupuncture can help our surgeon in postoperative condition, not only pain relief. We go for many countries to do the humanitarian health service, as you can see there in these pictures. We also go to WXA and to Ambon, Indonesia, and this one, for example, the facial palsy, after 1 year, still can be treated, and she was very happy. For example, sometimes low back pain, and we cannot do laminectomy immediately, then we still can do acupunctures for the patient. And also, the patient is getting well, and I can walk after our acupuncture treatment. So when we go for different ICS service, we will go together and do acupunctures, and also to Solomon Island, and even to Africa in Malawi. You can see that after laminectomy, the patient still cannot walk and still take morphine, still very painful. And after acupuncture, you are getting well. And also another patient after the eye operation, still very painful in the eye, and after acupuncture, she was much better. So it's important to have acupuncture treatment. And actually, I'm an anesthesiologist. Most of the time, the anesthesiologist will give opiate, NSAID, etc., and do a lot of nerve block. But I found that acupuncture is more effective than medication, and so now in my own pain clinics, I do all acupunctures and no more nerve block or medications. So to use acupunctures and go around for this health service, it will be helpful. So why Islamic medicine important? Because many common in TCM and Islamic medicine too. And it's very important to preserve all these traditional Islamic medicine too. During international humanitarian health service, many times our surgeons cannot do operation to help our patient, although we are already over there. Due to medical law in that country, that our surgeons are not allowed to do operations on their patients. Sometimes our equipment or their operating room condition and equipment is not sufficient or ideal. Sometimes they are suffering medical condition that don't need an operation. Sometimes what they need to manage their post-operative related pain that cannot be relieved with morphine or NSAID or other squealers of operation that cannot be managed by their surgeon. There is time we need to use the East-West native integrated neuroacupuncture system to help them. If not, we are hard to face our patient that we are there, so many surgeons not yet cannot help their suffering. So acupuncturist is a good team members in our ICS International Humanitarian Health Service. So it's important to make sure that acupuncture really can treat patients effectively and that can treat many diseases. So my way have been in this way, they call the neo technique. And even I use acupuncture sometimes to help patients in the ICU cases. So you can see that more and more disasters around the world, and need all of you, our ICS Humanitarian Health Service, to go around the world. Like in Taiwan, the Great Flood many years ago, I also use acupuncture to help our patients. So it's important to learn about the acupunctures. I also teach in UCLA, the East-West Integrated Centers years ago, to use acupuncture to treat their patient, and also carry out workshop over there. Even in Norway, there's acupuncture centers. Also, I go and teach them about the different way of acupuncture, and also in Malaysia, and also a lot of our friends in overseas also start to believe and interested in using acupuncture to treat their pain and other disease. Even, for example, sounds of breath for fibromyalgia, they are starting to use my way of treating the disease in their website. So very popular nowadays. Although the East and West are not totally familiar with each other, but we can cooperate to make them more understanding. And actually in the US troop, they are starting to use acupuncture to help their patient. And I also teach in China, academic Chinese medical science. You can see that many foreigners from 20 over countries in Europe and United States come to learn the acupuncture in treating the disease. So they are all specialists, Western trained specialists, and yet they cannot solve their own problem. So they are interesting to learn a new technique. So in my hospital, for example, after the neurosurgical operation craniotomy, still we can use scalp acupuncture to help them to improve much better, and also consultation from neurologists. For example, this case, the spinal cord tumor, after operated and remove the spinal cord tumor in the spine, the doctors tell the patient that she will never able to raise the leg and have to on wheelchair forever. She's only 16 years old. So after acupuncture, you can see that she can walk again after a few times of acupuncture. This is more interesting that the child have a nerve paralysis, and she got a nerve transplantation, still cannot raise her arm. So she came for scalp acupuncture, and can see that she can raise the arm and even throw things to far away. And this one with eye stroke. After the eye stroke, she cannot see. Even I put my hand in front of her, and now after the acupuncture, she can show her own name. And ear stroke also the same. So I share experience of scalp acupuncture for child development also. You can see that children also can undertake for scalp acupuncture for brain development delay, hyperactive, etc. For example, this hyperactive child, after a few times, he can help me to bring the chair in order, and also their eye contact, and also helping us a lot. So you can see that even so small child also can do receive scalp acupuncture, because the acupuncture over the scalp area is not so painful. So you can see that they are still smiling, so it can improve a lot. You can see the brain was so severe that actually the brain is so severe that we think that she cannot survive, but actually she only cannot hyperextend the thumb. And after scalp acupuncture, you can see the thumb can extend it. So this one, after the craniotomy and half the brain removed, still can improve with acupuncture, and she can use her hand to write. And for children that cannot speak and drawing, can do that after the scalp acupuncture. And this is so severe, you can see the eyes improving after the scalp acupuncture. This one, the so severe atrophy due to brain tumor, and after the scalp acupuncture can raise the arm. And we know that phantom pain is very difficult to treat, and scalp acupuncture can help. And facial palsy can improve, and also facial palsy that cannot open the eye can improve immediately. And also those with the eye twitching for all the time can improve and can stop the eye twitching and cannot concentrate. You can see the eyes different. So there's always pain follow operation, even after morphine or nerve block. There are also lots of discomfort beside pain, like dizziness, vertigo, abdominal fullness, weakness, numbness, neck stiffness, headache, blurred vision, frozen shoulder, etc. after your operation. Sometimes there are complications after the operation too. For example, paralysis after laminectomy. This most can be relieved with the East-West integrated acupuncture needing. Of course, you need to read a lot of book, and my paper also been involved in this textbook. So, for example, after severe spine compression and orthopedics have do the operation, but the patient still very painful even with the morphine. So they consult me to do acupuncture, and the patient was more happy. Even after a few times of laminectomy, the patient still complain of low back pain. We still can help with the acupunctures, and in this way we can help the patient to relieve their low back pain and can walk again. Even the condition is too severe to undertake the laminectomy, we still can help them to walk again. For example, these ladies after 2 operations of laminectomy getting worse and worse. In the end, both legs cannot move. So they consult me to do the scalp acupunctures, and you can see the leg can move again. This is the scalp acupuncture I have done for her. And for example, the scrotal pain and redness over here. After the needle over here, you can see that the pain totally go off, and immediately the skin or color also change back. So the paper said that cervical myelopathy and hand numbness due to the spinal cord and may need a cervical operation. But actually after the operation, maybe the hand got more complication also, and you can see the thumb cannot move up and can move better extension after I do the acupuncture for her. This is also cervical spine operation, and after the sweating that cannot be stopped all the time. So I do this acupuncture and the sweating go away. So numbness and tingling after surgery, there's a lot. We can treat this with trigger point needling or acupunctures, and the patient can relieve the numbness altogether. Even the patient with severe low back pain and compression spinal cord, but with severe aortic stenosis, that anesthesiologists dare not do the anesthesia for the patient because sudden death is so large. So we can see the heart is so severe. So I do the acupuncture for the patient, and the patient is more relieved and so happy. So even after the heart surgery, and then the cardiac surgeon say that the patient may be discharged, but the patient is so painful and discomfort and cannot breathing. So the cardiac surgeon asked me to do acupuncture for the patient, and the patient was discharged the next day. So you can do different things for the patient. And cancer metastasis to the spine, and they need to do the MRI to see where the compression was, but the patient cannot lie down to undertake the MRI. So even after 2 times of morphine, so I do the acupunctures for them, and then go inside. But you know that acupuncture cannot go to the MRI, so I do before they go in, and then massage those points during the MRI. So in this way, the patient can undertake the lying down comfortably, and we can successfully done MRI. So these are the things that we can help with a stroke patient, and they can recover much faster. Even the choking after the stroke can use the facial acupunctures. Even a speech problem, they can speak better and even tell story after the scalp acupunctures. I developed a new acupuncture systems in the development of neurological disease and child brain development. Even the lung cancer, after the operation, they still feel the pain. We still can help with acupuncture, and I wrote book on that. And those for these hemorrhoid pain after the operation still painful, we can do acupunctures, and you can see sometimes there's a sign in the ear area where the hemorrhoid point is in ear acupunctures. So even after the operation, we can see that the patient may complain pain around the anus, and still we can do acupuncture to help. So even after the hysterectomy, the patient complain a lot about pain inside the vagina, still we can use acupuncture to help. And we know that trigeminal neuralgia is difficult to treat, even you prescribe a lot of medication, even nerve block. And you can see that the patient is still in the same clothes, already smiling after my acupuncture for her. And the patient cannot wash his hand after the facial trauma. So with acupuncture, you can see that he can wash his hand again. So you can see that the facial palsy, the eye canal opening, and even after the scalp acupunctures, you can see that dark hair is growing, even elderly. And you can see that stroke patient can walk after acupuncture in the scalp area. So they come in with a wheelchair and can walk outside. So actually, we needle only at the scalp area. You can see that I wrote books on acupuncture treatment of cancer pain and management to treat all this cancer pain. And dynamic acupuncture and intramural needling is that use only very, very tiny, small acupuncture, ear acupuncture needle to treat all over the body. Even headache, blurring vision, vertigo, after craniotomy, neck operation, brain metastasis, etc., we still can treat this patient very easily, because we never ask where is your headache or where is your vertigo. There are so many different type of headache. We call it body language, that will show you which muscles is involved. Then you can treat the headache totally well. So you can see that different headache have different refer pain and also different component. And also, for example, this one, a lot of patients after the gallbladder operation will continue complain that he got a low abdominal pain, and we'll think that maybe infection or other leakage of the gallbladder. But usually with the latissimus dorsi muscle needling, then the pain will go off. So even with the morphine, still cannot relieve the post gallbladder operation. We can treat very easily with acupunctures. So you can see that even appendectomy already done and still painful over that area, we can actually do the acupunctures for the patient. So even the breast cancer or breast pain, that we think that is due to the breast cancer, but most of the time is due to the pectoris major or minor trigger point. For example, frozen shoulders, that's difficult for treatment. Even after operation or physio, we can easily done that in our clinic, and the patient improve immediately. And knee pain is more dramatic, because usually we think that with the spur formation over there, degeneration of the knee, and we need to do arthroscope or put PRP, etc. to the knee, but still the pain is there. So we actually can needle over this area. Even if you have a total knee replacement, and yet we can do acupuncture and no need to do another knee replacement operation. So, and no need to do the arthroscope and use a lot of money. And we forget that our knee is actually like the puppet show. The bone is like the wood, and the string is like our muscle. We totally neglected the importance of our muscles, and this is what we wasted a lot of medical resources. So for example, the leg is so huge and difficult to walk, we can use scalp acupuncture to help the patient walk again. And after that, the patient is getting swollen after a few days, and we do the tongue acupunctures that can help the patient to resolve the pain. Of course, this patient need operation for the lymphatic drainage. And last of all, there's so many acupuncture points in the ears that can help you. We know that we are all worried and sad, so be happy and don't worry. That is the thing that you must take home, and it's important that this point you massage often. This point, and you'll be happy. And so, thank you for your listening. Thank you.